Hi everyone, welcome to researchmd.com. Another great presentation today. We're going to continue our journey into the cephalosporin. Today we're going to talk about 5th generation cephalosporins. And again, my name is Dr. PRAMIL. I'm a practicing physician in the United States, Program Director, Internal Medicine Residency, Transitional Residency, Associate Professor of Medicine, 2 large medical schools. Okay, so let's visit 5th generation cephalosporin today. Okay, let's take a step back and see what's our plan for today. We're going to talk about the cephalosporin, the structure of the cephalosporin, and then we're going to look at the structure of the 5th generation cephalosporin. And then we're going to look at the mechanism of action and some of the resistance. And then we're going to talk about the gram-positive coverage, gram-negative coverage, and the anaerobic coverage. And then we're going to look at the most important drug in that category. Okay? Again, let's start with the structure. So when you talk about the cephalosporin, this is a group of drugs, got like 2 major rings, okay? The first one is the dihydrothiazine ring, this one. And then you have the usual famous beta-lactam ring right here. Okay, remember that. So what is the structure? Trihydrothiazine ring, and you got the beta-lactam ring. Now let's look at what do. They make drugs based on the combination on the R1 and the R2 structure is kind of changed, and then make this new drug called 5th generation cephalosporin. Now, let's look at the mechanism of action. Again, same thing with all the cephalosporin. It inhibits the penicillin binding proteins and prevent the peptidoglycan formation in the bacteria. Okay, and then remember our lame mnemonic. That's where like not active or resistance. Listeria for L, A atypical, M mycoplasma, E enterococci. Be careful about the enterococci. One of the drugs, the ceftobiprole, is active against enterococci, but it's not used in the United States. Remember that, okay? You can use the mnemonic, but be careful about enterococci, because the drug ceftobiprole is active against enterococci. Now, when you look at the gram-positive coverage, we have Streptococcus pyogenes, Streptococcus viridii, and Strep pneumonia, and Staphylococcus, MRSA, methicillin-resistant Staph aureus, right? It's very common in the community. 50% of the people have like infections and all that can have MRSA. So it's very, very important for main coverage, I think, can be used against MRSA because it's one of the very resistant organisms to treat. When you look at the gram-negative, some E. coli, Pseudomonas, some Klebsiella, Proteus, many other Enterobacteriaceae, Haemophilus, Moraxella, and Neisseria. I'm going to say about the Pseudomonas, okay? Pseudomonas, there are 3 main drugs in this category. Ceftaroline does not have any Pseudomonas activity, but ceftobiprole only ceftobiprole has Pseudomonas activity. Don't forget that. Okay, it's very, very important. If you wanted to cover Pseudomonas, the main drug used in the United States is ceftaroline. It doesn't have any Pseudomonas activity. Okay, but if you need to know one drug, ceftobiprole, that does have against Pseudomonas, and that also covers like enterococci, but it's not used in the United States, remember. Now, anaerobics, the gram-positive anaerobe like Clostridium may cover, but this does not have any activity against the gram-negative anaerobes, okay? Now, let's look at the general characteristics. Therapeutic concentration, again, it reached in most of the tissues. The number 1 drug we need to know, the prototype of 5th generation drug, 5th generation cephalosporin is ceftaroline. It's given IV 600 mg Q12 hours, renally excreted. Make sure you adjust the dose in the renal. You always look at the creatinine clearance. If the creatinine clearance is 30 to 50, you get 400 mg Q12. If it is 15 to 30, you get 300 mg. And it's less than 15 creatinine clearance, you just start with only give 200 mg. So remember, it's renally excreted. Now, the other drug we still need to talk about is ceftobiprole, not used in the United States, got coverage, it's given IV, has coverage against Pseudomonas and enterococci. Okay? This is very important. And ceftolozane, used in, it's a combination with the tazobactam, but That is the only time we use it, okay? So remember, let's look at the major points again. We need to know the difference, the structure of the cephalosporin. We know it works with the penicillin binding protein, and that is, I mean, it cannot produce the peptidoglycan cell in the cell wall. Remember the mnemonic: lame, listeria, atypical mycoplasma, except this enterococci. Don't forget it. Enterococci has a coverage, one subtobiprol. Okay, and remember, gram-positive MRSA, very, very important. And then some coverage against the Clostridium, gram-positive Clostridium. Two main drugs, ceftriaxone and ceftobiprol, and the other one, cephalosporin, is used in combination with the Tazobactam. Thank you so much for watching. We'll be back with another presentation. God bless.